Right now, tonight, there is something you're probably doing completely alone, something you've done for decades, and it is quietly destroying your heart, your prostate, and your ability to feel real pleasure ever again. And here's the scary part: you have absolutely no idea you're doing it wrong. I'm Dr. Natalia Parker, and in the next few minutes, I'm going to show you exactly what it is. 3 weeks ago, a 69-year-old man walked into my office. Let's call him Robert. Robert came in complaining about chest tightness, blood pressure that was completely out of control, and urinary problems that were waking him up 4, sometimes 5 times every single night. We ran every test you can imagine, and when all the results came back, I sat down with him, just the two of us, and he told me something that changed everything about his diagnosis. Robert had a routine, a private routine, one he repeated every single morning in the same place, using the same method, always rushing, always under pressure. And that routine, that habit he thought was completely harmless, was literally putting his life at risk. You want to know what I found? Robert was making 6 out of the 7 most dangerous mistakes a man over 60 can make. 6 out of 7. And the 7th? I'll get to that, but not yet. Because first you need to understand something that most doctors will never tell you. There is a conversation that should have happened in every doctor's office, every men's health clinic, every urology waiting room in this country. And it almost never does. We talk around it. We hand out pamphlets about blood pressure and cholesterol. We warn about smoking and alcohol. But nobody sits down with a man over 60 and says, the way you're handling your own private sexual health right now could be the thing that kills you. Or at the very least, the thing that quietly robs you of every ounce of pleasure your body has left. That silence is something I refuse to keep. I've spent 17 years working with men over 60. I've treated more than 1,000 patients in this specific age group. And what I've learned is this: the mistakes I'm about to show you are not caused by ignorance. They're not caused by laziness or stupidity. They happen because nobody, not one single doctor, ever told these men that everything their body needs changes after 60. Nobody explained the rules had changed, and so they kept playing the same game with the same moves, not realizing the board had shifted underneath them. Before I get into the 7 mistakes, I need you to understand one thing first, because without this foundation, nothing else I say today will make sense. After 60, your body is not the same machine it was at 35 or 45. Your cardiovascular system runs slower. Your arteries have lost a significant portion of their elasticity. Your heart has to work considerably harder to push the same volume of blood through your body. Your testosterone, and this is something most men don't hear clearly enough, drops between 1 and 2% every single year starting in your early 40s. Do the math on that. By the time you're 65, you could have lost 25 to 40% of the testosterone you had in your prime. And your prostate, which I'll come back to in a moment, is almost certainly larger than it was 20 years ago, pressing on your urethra, making urination harder, creating pressure and discomfort you've probably learned to just accept as normal. Here's what I need you to understand about all of that. None of it is dangerous on its own. It's a completely normal part of getting older. The danger, the real, serious, life-threatening danger, comes when you pair those physiological changes with habits that were designed for a 35-year-old body. Imagine you have a classic car from the 1970s. Beautiful machine, built to last. But if you try to drive that car the way you drive a brand new performance vehicle, flooring the accelerator, slamming the brakes, skipping all the maintenance, what happens? You know exactly what happens. It breaks down. Expensively, permanently. Your body works the same way. And there are 7 specific ways men are running their engine straight into the ground, starting with the most common one I see and arguably the most physically damaging. Mistake number 1, and I want you to really hear this, is using excessive escalating pressure. Robert told me exactly this in our first appointment. Doctor, every year that goes by, I have to grip harder just to feel anything. It's like my body went completely numb. And here's why that was happening. Robert had spent years training his nervous system to respond only to extreme stimulation. Think about what that actually means physically. When you grip too hard, you're compressing the blood vessels in one of the most delicate, vascular dense regions of your entire body. You are literally cutting off circulation to tissue that depends on blood flow to function. Over time, that compression damages nerve endings, the microscopic structures responsible for transmitting every signal of pleasure your body sends to your brain. And here's where it gets dangerous after 60. Your nerves are already naturally less sensitive than they were 2 decades ago. That's just aging. That's unavoidable. But when you add years of excessive grip pressure on top of that natural decline, you are accelerating the desensitization at a rate that no amount of willpower can reverse on its own. There's a condition in clinical medicine we refer to as pressure-induced desensitization syndrome. It's not death, but for your sex life and potentially for your relationship, it might as well be. I treated a man named Frank, 66 years old, married for 37 years. He came to me completely broken. I don't feel anything anymore. I can't respond to my wife. After an honest conversation, we traced it back. Years of high-intensity mechanical devices at maximum settings every single day. His nervous system had completely forgotten what natural human contact felt like. It took 4 months of structured sensory retraining before he could regain his natural sensitivity. But here's the part that matters. His marriage survived. His body healed. That recovery is possible, but you have to stop the damage first. And if you're wondering whether you might be doing this right now, stay with me, because the answer is coming. Mistake number 2 is one that's going to surprise you. It might even sound ridiculous when I first say it. The mistake is always doing this in the bathroom. I know exactly what you're thinking. Doctor, it's the most private room in the house. What's wrong with that? I hear that every week, but let me walk you through what your body is actually experiencing in that space, because the bathroom creates 3 separate problems that most men never connect to their health issues. The first is physical position. Most men in the bathroom are seated, and in that seated position, you are compressing your entire pelvic region. The blood vessels that feed your prostate, your bladder, all of that critical anatomy, they're being pressed together. Remember what I just told you about circulation? After 60, your blood flow to that region is already slower than it was. Adding physical compression on top of that is like squeezing a garden hose while you're trying to water your garden. The pressure builds in the wrong places, and the places that need flow don't get it. Over years, that pattern contributes directly to erectile dysfunction, not occasionally, consistently. The second problem is psychological pressure. Nobody lingers in the bathroom. You're tense, you're rushing, your breathing goes shallow, your heart rate spikes without any warm-up. Your blood pressure shoots upward abruptly. I have seen clinical cases, documented real cases, of men experiencing cardiac arrhythmias, men who had what appeared to be early-stage cardiac events, all because they were engaging in intense physical exertion in a confined, poorly ventilated space with no cardiovascular preparation whatsoever. The third problem, and this one is psychological but equally destructive, is neurological association. Your brain is a pattern-forming machine. When you repeat a behavior in the same place over months, over years, your brain builds a powerful neural connection between that space and that response. And what that means, practically, is that your body begins to struggle to respond anywhere else. In the bedroom, with your partner, in a moment of actual intimacy. Your brain isn't in its place. The circuit doesn't fire the same way. I'll tell you what to do about this in a moment. But first, you need to know about mistake number 3, because this one is the single biggest driver of cardiovascular risk that I see in men over 60. Mistake number 3, rushing through everything. No warm-up, no preparation, total focus on just getting it done. Here is a statistic that stopped me cold the first time I really looked at it in my own patient data. More than 80% of the men over 60 I see in clinical settings, when they're being honest, report that they complete this activity in under 3 minutes from start to finish. 3 minutes. For a man whose cardiovascular system has been slowing down for 2 decades, that is a physiological emergency waiting to happen. Think about what happens inside your body when you rush. Your heart has to dramatically increase its output in a very short window. Your blood pressure doesn't rise gradually, it spikes. abruptly, without warm up. It's the equivalent of asking a 65-year-old man who hasn't exercised in months to immediately sprint 200 meters. The body can attempt it. The risk of serious injury, or worse, is real. But here's something the cardiovascular risk doesn't even capture. The rushing is robbing you of the experience itself. When you're only focused on reaching the finish line as fast as possible, you're not experiencing anything along the way. You're not connected to your body. You're not enjoying the process. You are generating maximum physiological stress in exchange for minimum pleasure. That is a terrible trade-off at any age. After 60, it's also medically reckless. What I tell my patients is specific. Set aside a minimum of 12 to 15 minutes. Begin slowly, deliberately. Breathe deeply and consciously throughout. Allow your cardiovascular system to pace itself. Allow your nervous system to engage gradually. I promise you, the pleasure will be more intense, the satisfaction will be deeper, and you won't be putting your heart through a stress test without a doctor in the room. Comment below and tell me what state you're watching from, because I work with men from all over the country who are dealing with exactly these same issues and have never once had a doctor talk to them honestly about any of this. Mistake number 4. This one seems basic. It seems obvious. And yet I cannot tell you how many men come through my practice who have never once done this correctly. The mistake is not using proper lubrication. After 60, the skin changes. It thins. It becomes more fragile. It loses some of its natural protective qualities. If you are creating friction without appropriate lubrication, you are creating thousands of microscopic tears in some of the most sensitive tissue in your body. Those micro tears inflame. They can become infected. They cause dermatological issues that require medical intervention. And here is something I need you to really hear. Do not use whatever you find under the sink. Not soap, not shampoo, not lotion with fragrance, not cooking oil, not anything that was designed for a different purpose. Those products contain chemicals that can severely irritate the mucosal tissue in that region, cause contact dermatitis, trigger allergic reactions, and in serious cases, cause chemical burns in an area that has no business being burned. Use a water-based lubricant specifically formulated for intimate use. You can find it in any pharmacy, it costs almost nothing, and the difference in comfort, in safety, in actual physical sensation is night and day. I had a patient, James, 64, who came in terrified, convinced he had cancer or an STI. After a careful, honest conversation, we found the problem. He had been using bar soap as his only lubricant for years. A simple switch to a proper water-based product resolved everything in 2 weeks. 2 weeks to fix a problem years in the making. Take that win. Mistake number 5 is the one that tends to generate the most pushback when I bring it up. And I want to be very clear before I say it. I am not here to judge anyone's choices. What you choose to do in your private life is your own business. But my job as a physician is to tell you the medical truth about what chronic pornography use does to the neurological architecture of the male brain after 60. And that truth is this. It rewires your dopamine system in ways that can make natural intimacy impossible. Here's the mechanism. When you consume pornography, especially when the content escalates over time toward more extreme material, your brain floods itself with dopamine. Dopamine is the neurotransmitter of reward, anticipation, and pleasure. It's one of the most powerful chemical signals your brain produces, and it's highly adaptive, meaning your brain adjusts to whatever level of stimulation it receives most frequently. When that level is set at extreme artificial visual content, everything below that threshold stops triggering a meaningful dopamine response, which means your wife stops triggering it. A real intimate moment stops triggering it. Your body's natural capacity for arousal gets recalibrated towards something that doesn't exist in your actual life. I've treated dozens of men in this exact situation, and I want to tell you something honestly. The recovery process is long. It requires real discipline and real commitment. But here's what I need you to hold on to while I tell you the rest. Complete recovery is possible. A study conducted recently showed that men over 60 who consumed pornography on a daily basis were 4 times more likely to develop severe erectile dysfunction compared to men who abstained or used it very occasionally. 4 times. That is not a marginal risk, that is statistically catastrophic. If you recognize yourself in this pattern, here is my professional recommendation. Commit to a complete, deliberate detox. 45 days with no pornography of any kind. The first week will be uncomfortable. Your brain will actively protest. It will look for its dopamine hit. But after the second week, most men report this consistently, your natural sensitivity starts to return. You begin responding to things that are real. The way your wife moves across a room, a look, a casual touch, the warmth of actual human presence. And there's another dimension to pornography use I haven't mentioned yet, one that may actually be doing more damage to your relationship than the neurological effects. I'll get to that in a moment. But first, you need to know about mistake number 6. Mistake number 6, over-relying on high-intensity mechanical devices. I know some of you use automatic male stimulators, the kind with vibration, suction, mechanical motion. And I want to be clear, an occasional moderate use of these devices is not inherently a problem. Variety used with awareness is not dangerous. The problem, and this is a serious one, appears when these devices become a daily habit used at maximum intensity, with no moderation whatsoever. What happens to your nervous system is the same process I described with excessive manual pressure, but amplified dramatically. These devices create a level of stimulation so intense, so artificial, so far beyond what any human body naturally produces, that your neurological response system adapts entirely to that artificial standard. And then, when you're with your partner in a real, human, warm, intimate moment, your body doesn't respond. Because a real person doesn't vibrate, doesn't generate mechanical suction, doesn't move with robotized consistency, and instead of recognizing that you've created this problem yourself, the mind does what the mind always does. It looks for an explanation. I'm too old, my body is broken, she doesn't excite me anymore. None of those things are true. The truth is that you desensitized yourself. I had a patient, Gary, 67 years old, who invested in one of the premium devices on the market, expensive, high-rated. He used it every day for about 8 months, and then he realized, with horror, that he had completely lost the ability to be intimate with his wife of 34 years. No sensation, no response, nothing. His wife thought he was having an affair. He fell into a depression, convinced his sexual life was over. It took nearly 5 months of disciplined work, no device, structured resensitization exercises before his natural responsiveness returned. 5 months. If you currently use these devices, my clinical recommendation is to limit use to a maximum of twice per week and never at maximum intensity. Always start at the lowest setting. Your body needs to retain its ability to respond to human contact. That ability is worth protecting. And speaking of human contact, this brings me directly to the medical guide I put together specifically for men navigating these issues after 60. It's called the Medical Guide to Avoiding the Mistakes That Damage Your Prostate. After 60, and it's available right now in the pinned comment below this video. It walks you through every protocol I've mentioned today, the sensory retraining exercises, the cardiovascular preparation techniques, the specific recommendations on frequency and method. All in plain language, no medical jargon, no judgment. Thousands of men have already used it to completely transform their sexual health and their overall quality of life after 60. It's in the pinned comment. Don't skip past it. Now, mistake number 7. This is the one that ends marriages. This is the one that creates damage that goes far beyond physical health. Damage that reaches into the emotional core of a relationship and can quietly destroy it over years. The mistake is substituting this private habit for real intimacy with your partner. Masturbation is healthy. It's normal. It's a natural part of human sexuality at any age. I will never tell you otherwise. But it cannot, under any circumstances, become a replacement for real human connection. What I see in my practice over and over is men who maintain a daily private habit while going weeks, sometimes longer, without any meaningful intimacy with their partners. And when she reaches out, when she initiates, when she asks for connection, he's tired. He's not in the mood. He doesn't feel up to it. And here's what he doesn't realize: it's not fatigue, it's not age, it's physiology. After 60, your refractory period, the recovery window your body needs after an orgasm, is significantly longer than it was at 35. If you had an orgasm this morning, your body is genuinely not going to be ready tonight. It is not a willpower issue. It is not a relationship issue. It is simple, unavoidable biology. But the damage goes deeper than the physical. Sex with another person involves something that a solo habit never can: connection, vulnerability, mutual presence, communication without words. When you consistently choose the private habit over genuine intimacy, you are slowly, quietly withdrawing from one of the most important bonds in your life. I treated a couple, the wife was 61, who came in after she discovered her husband had been maintaining a daily private habit while they hadn't been intimate in nearly 3 months. She wasn't angry. She was devastated. She felt invisible. She thought she had become unattractive, that he had found someone else. Her self-worth had collapsed. When I spoke with him separately, I understood immediately. He had built a comfortable routine, private, fast, no performance pressure, no vulnerability. It felt easier, and that ease was dismantling a 41-year marriage one morning at a time. The guidance I gave them was direct. If you are in a committed relationship, intimacy with your partner must come first. The private habit is a supplement. When she's unavailable, when you're apart, when the need arises outside of shared moments. It is never a substitute. They followed that guidance. Their relationship recovered. Her confidence returned. And he discovered something he hadn't expected: shared pleasure, real connection, the kind built over 4 decades of shared life. It is infinitely better than anything a solitary routine could offer. That discovery is available to you too, but you have to make the choice. Here's what I want you to hold on to as we approach the end of this. None of these 7 mistakes happened because you were careless. None of them happened because you made bad decisions. They happened because nobody, not your doctor, not your father, not a single person with medical authority, ever sat down with you and said, after 60, the rules change. Your body needs different things. Your habits need to adapt. The way you've been doing this for 30 years is no longer serving you, and in some cases, it's actively hurting you. Our culture built an absurd wall of silence around male sexual health after a certain age. The assumption, unspoken but pervasive, is that once you pass 60, this part of your life is either over or irrelevant. That assumption is wrong. It is medically wrong. It is factually wrong. And it is costing men their cardiovascular health, their sensory capacity, their relationships, and their quality of life every single day. Your sexuality does not have an expiration date. Your capacity for pleasure is not determined by your age. What changes is the method, the approach, the timing, the physical needs that have to be respected. And when you learn to respect those needs, something remarkable becomes possible. I have personally witnessed men in their 70s, men in their early 80s, reclaim a sexual vitality they were convinced was permanently behind them. Men who told me, and I have heard these exact words more than once, I thought that part of my life was over. It wasn't over. It was waiting for the right information. So here is what you can do right now, today, not tomorrow, today. First, be completely honest with yourself about which of these 7 mistakes you recognized. Not guilty, not ashamed, just honest. Awareness is the foundation of every change that follows. Second, pick one thing and change it, not 7 things at once. That's a guaranteed path to frustration and giving up. One change: use the right lubricant. Change your location. Set a timer for 12 minutes and commit to it. One step, taken consistently, builds more momentum than a complete overhaul abandoned after a week. Third, if you have a partner, consider opening a conversation you've probably been avoiding. I know how uncomfortable that feels. I know how much you'd rather just handle this privately, but I promise you, she would rather have one awkward, honest conversation than spend another month wondering what's wrong. Communication is not a weakness, it is the single most protective factor in long-term relationship health. Fourth, if you recognize addictive patterns, if the pornography habit has a hold on you that feels beyond your control, if you've tried to stop and couldn't, if your sexual function is already severely compromised, please seek professional support. A urologist, a certified sex therapist, a behavioral health specialist who works with addiction. There is no shame in that. It is the most self-respecting thing you can do. Your body is not broken. Your desire is not gone. Your capacity for real, deep, satisfying pleasure is still inside you, waiting for the habits that support it rather than suppress it. This is recoverable. All of it is recoverable. But the recovery starts with knowing what you're dealing with. And now you know. If this helped you, if you heard something today that you needed to hear, if you recognize something about your own habits that you're ready to change, subscribe to this channel right now. Because this is what we do here. We talk about the things that matter to men over 60, the things most doctors skip, the things most channels are afraid to say clearly. I'm Dr. Natalia Parker, and I will be here every single week with honest, science-based, judgment-free information about your health, your body, and your life after 60. Take care of yourself. I'll see you in the next one.